Good morning, ma'am. This is Annalyn Macalya-Gadingan, your reporter about the respiratory syncytial virus, or also known as the RSV. My task is to discuss its epidemiology, morphology, pathogenesis, common symptoms, as well as the ways to prevent this infection. The epidemiology of the RSV infection is very prevalent worldwide. So it is not just common in one place but also worldwide. Highly contagious in nature, highly prevalent in young children with a peak incidence in 2 to 8 months of age. Virtually all children are infected by RSV by the age of 4 kasi nga yung mga babies natin, they have a weak immune system pa kaya sila usually yung tinatamaan ng RSV. Usually seasonal, mostly occurring during winter. Shed in respiratory secretion for several days, sometimes week. Nosocomial infections are present. When we speak of nosocomial infections, these are hospital-acquired infections. Outbreaks occur in neonatal wards of maternity hospitals, sometimes inflicting with high mortality. Pag hindi siya naagapan, maari itong makamatay or ikamatay ng victim. Yung morphology ng RSV, it is a regular spherical particles that range in diameter from 150 to 300 neuromicrons. Consist of nucleocapsid within a lipid envelope. So, ini-enclose siya ng nucleocapsid and is non-segmented, single-stranded, negative sense genome of helical symmetry. It has 4 nucleocapsid proteins packaged in the virion. The major proteins are the phosphoprotein, the anti-termination factor M2-1, and the large polymerase subunit L. The viral glycoproteins are organized separately in virion spikes, which are visualized as short 11 to 20 neuromicrons closely spaced intervals of 6 to 10 neuromicrons surface projections. There is also a matrix M protein that is thought to form a layer in the inner envelope phase. RNA genome is 5 to 6 kb long and genome encodes 11 proteins. Kung makikita natin dito, mayroon siyang nucleocapsid proteins. Those nucleocapsid proteins is composed of 4. Yung nucleoprotein natin, ito siya, yung the violet colored. The phosphoprotein is the green colored one. The large polymerase, yung malaking colored na parang siyang at the end of the RNA. Makikita siya at the end of yung RNA chain. And the M2 subunits M1 and M2. So, tinatawag siyang ribonucleocapsid proteins. Kung mapapansin nyo, para siyang ribosomes. As we talked on our DNA, mayroon siyang ribosomes. These ribosomes or ribonucleocapsid proteins, these ribosomes or yung mga maliliit na ribosomes are binded together. These ribonucleocapsid proteins binds together to protect the RNA chain. Yung RNA natin dyan, yung parang nagko-coil na red. Sa inner envelope protein naman natin, ito yung tinatawag na matrix M or yung color green na nakapaligid doon sa ating RNV cell, RSV cell. And yung envelope proteins na yung fusion niya, etong parang mga spikes, yung envelope proteins is yung parang spikes ng ating RSV virus, yung sa structure natin. Sila yung color green, the color green one, this one. Yung G attachment naman is yung color blue, and the small hydrophobic is kulay pula. So, that is how RSV or the respiratory syncytial virus is structured. Next. If we are to look this RSV in a electron microscope, ganito siya, ganito yung formation niya. Circular, tas parang may coil sa gitna. Ito yung RSV, yung cell surface with a receptor. Next, punta naman tayo sa pathogenesis. RSV is restricted to the respiratory tract. It is, yung RSV natin, tinatarget niya yung respiratory tract lamang natin. Inoculation of the virus occurs through the upper respiratory tract and initiates infections in the epithelial cells. So this RSV inoculates first in our upper respiratory tract. Our respiratory tract is composed of two, yung upper tsaka yung lower. Yung upper natin is composed of yung nasal, pharynx, and the larynx. So doon siya mauuna na mag-inoculate, papasok siya sa ating epithelial cells at doon siya mag-i-infect. The virus subsequently spreads along the epithelium of the respiratory tract, mostly by cell-to-cell transfer of the virus along intracytoplasmic bridges or syncytia formation. So, once na nakapasok na siya sa ating upper respiratory tract, nakapasok na siya sa ating epithelial cells, doon siya mag-i-invade sa ating cells through cytoplasm to cytoplasm. So, nagbe-bridge siya na tinatawag na syncytia formation. Pag sinabi kasi nating syncytia formation, once na infected na yung isang cell, mag-fuse siya sa kanyang neighboring cells, causing it to be infected. Tsaka parang nag-create siya ng bridging. Infected to, mag-infect siya dito, tapos mag-infect hanggang sa dumami na yung infected cells. Next, the virus usually does not cause any viremia or systemic spread. Once we say viremia, or ito yung the virus will inoculate to the blood, but sa case ng ating RSV, hindi siya pumapasok sa ating blood or sa ating, hindi siya nag-create ng systemic spread. Doon lamang siya nakafocus lamang siya doon sa infected cells at hindi siya pumapasok sa ating blood. As the virus spreads to the lower respiratory tract, it may produce bronchiolitis and or pneumonia. So once once na pumasok na siya or nag-spread na siya yung virus from upper respiratory tract to lower respiratory tract, it may produce yung mga common na bronchiolitis tsaka pneumonia. Virus causes necrosis of the small airway epithelium. Pag sinabi nating necrosis, parang plugging. Yung ating airway, napla-plug ng dahil doon sa virus. Pinapatay niya yung cells doon sa infected area, causing pluggings of lumens, yung ating airways, with exudes, or yung mga parang, what we call this, the fluid, like, yung parang fluid or yung phlegm, and edema, or yung nagkakaroon ng swelling. Edema is swelling, leading to the obstruction of normal airways. Yung symptoms. Ano nga ba ang symptoms ng respiratory syncytial virus? People infected with RSV usually show symptoms within 4 to 6 days after getting infected. Symptoms or RSV infection usually include runny nose, decrease in appetite, coughing, sneezing, fever, and wheezing. So it takes 4 to 6 days para lumabas yung symptoms. Halimbawa, infected ka ngayon, 4 to 6 days pa lalabas yung symptoms na this includes all of this. Okay, next. Punta na tayo sa RSV prevention. There are steps that you can take to help prevent the spread of RSV. Specifically, if you have cold-like symptoms, you should. So, sa mga in cases na parang mild lang, or like cold-like symptoms lang, you can cover your coughs and sneezes with tissues or your upper short sleeves. Yung upper short sleeves, not your hands. Wash your hands often with soap and water for at least 20 seconds. Avoid close contact such as kissing, shaking hands, and sharing cups and eating utensils with others. Clean frequently touched surfaces such as doorknobs and mobile devices. So we should need to keep ourselves hygienited, or yung always siyang clean. So more specifically yung sa ating doorknobs and mobile devices sa ating bahay, kasi yun dun kadalasan namumugad yung mga bacteria and viruses. Avoid touching their face with unwashed hands. Limit the time they spend in children care centers or other potential contagious settings, especially during fall, winter, and spring. This may help prevent infection and spread of the virus during the RSV season. And researchers are working to develop RSV vaccines, but none are available yet. A drug called palivizumab is available to prevent severe RSV illnesses in certain infants and children who are at risk of severe diseases. The drug can help prevent serious RSV diseases. Nagpe-prevent lang siya na mapaserious yung RSV disease, but it cannot help cure or treat children already suffering with RSV, yung mga serious na. Hindi siya nagtitreat or nagkukure. Nagpe-prevent lang siya para mapaserious yung illness. It cannot prevent infections with RSV. So that ends my report. I hope we have learned something today. This is Annalyn Macalya Ganingan, your reporter, signing off.